I'm Dr. Gerald Chodak, and this is ProstateVideos.com. In July 2010, an important study was published in Lancet Oncology. It was a prospective, randomized, controlled study looking at the effect of screening men with a PSA test every 2 years. Men between the ages of 50 and 64 were invited to get tested, starting at their age and continuing until they reached the age of 71. The study has been following patients now for 14 years. Most of the men have been followed that long. And the results show a statistically significant improvement in the death rate from prostate cancer. About 9 men out of every 1,000 died from prostate cancer if they did not get screened, but only 5 men per 1,000 died from prostate cancer if they did get screened. So the net benefit was 4 men out of every 1,000 was able to avoid dying from prostate cancer by getting a PSA screening test every 2 years. Now, the challenging message here is the following. The overall survival was the same. In other words, although men were less likely to die from prostate cancer by getting screened, they just died more often from some other disease. And so that leaves everyone with a challenging decision to make. Is the amount of benefit worth it, especially considering the risks that are associated with the various treatments, mainly impotence and incontinence? Each man is going to have to make a decision for himself, whether the odds of benefiting are sufficient. Essentially, for every 15 men who were diagnosed and treated, 1 was able to avoid dying of his disease. So some people might feel that only 1 out of 15 chance of benefiting is not enough to take on the risks of the side effects. It essentially means that perhaps 14 out of 15 are getting diagnosed and possibly treated when they didn't need it. Now, clearly we're going to have to follow people longer, but there is a couple of important messages here. There are a couple of messages here. Number 1, if you have a life expectancy of 10 years or less, you're probably not worth getting screened because they didn't see a benefit until after 10 years of follow-up. The other thing each man is going to have to decide is whether the risk is worth the benefit. Is it worth undertaking the chance of being diagnosed and getting treated if the chances of living longer are not really present so far? This is going to be a difficult decision for each person to make. Clearly, if someone wants to avoid the risks and the harms associated with prostate cancer, then getting diagnosed and getting treated aggressively is the best thing that they can do. But overall, society may have a difficult decision to make, and that is whether the net benefit in society is worth it. Each individual will be able to make the decision for themselves, but it's important that everyone recognizes what are the odds of benefiting and what are the odds of getting side effects or having one's quality of life affected. Hopefully you will find this information useful. Thank you.